Hello and welcome to the Pharmacy Times News Network. I'm Mike Glakar and your host for our Pharmacy Week in Review. New Jersey could become the next state to permit pharmacists to provide birth control without a prescription. Like other states, New Jersey would require pharmacists to complete a training program that will be developed by the state's Board of Pharmacy. Pharmacists would also be required to provide a self-screening risk assessment tool prior to prescribing birth control. Based on the results, the pharmacist could either dispense the contraceptive or refer the woman to a physician. New Jersey's bill generally follows the same guiding principles underpinning legislation passed or being considered in several other states, which is to remove barriers preventing women from accessing birth control in order to improve public health. In other pharmacy news, the National Association of Chain Drug Stores Foundation has launched a Zika virus education initiative in Puerto Rico that encourages women to consult pharmacists and physicians about ways to protect themselves and their unborn children. The campaign is being broadcasted through radio messages and subsequent online placements targeted at women in Puerto Rico. Puerto Rico is the first U.S. jurisdiction to report local transmission of Zika virus. The CDC expects cases to continue to occur throughout 2016. Speaking of Zika, Quest Diagnostics recently received emergency use authorization from the FDA for its real-time qualitative Zika virus RNA test. Previously, Zika tests had only been available from the CDC and were only used in qualified laboratories designated by the CDC. Quest Diagnostics said it will make the test available to physicians this week. Pharmacists may be receiving more questions about Nexium 24-hour after Pfizer launched a Facebook ad campaign featuring sock puppets discussing the OTC acid reducer. Pfizer's use of puppets and humor is intended to empower patients to use Nexium 24-hour to downplay the role that heartburn plays in their lives. In policy news, the only pharmacist in Congress recently penned a passionate op-ed to make a case for pharmacist provider status. Representative Buddy Carter lamented that pharmacists have become the most overtrained and underutilized professionals in America because of their lack of provider status. He further explained that the entire U.S. healthcare system would benefit from provider status with respect to the healthcare spending because medication-related issues drive spending patterns. Representative Carter expressed similar sentiments when he spoke to Pharmacy Times earlier this year about his pharmacist past and political progress. For more great coverage and practical information for today's pharmacists, visit our website and sign up for our daily e-news. And don't forget to follow us on Facebook, Twitter, and Instagram. Thanks for watching our Pharmacy Week in Review. I'm Mike Glakar at the Pharmacy Times News Network.